Susan, we talk a lot about preventive care, and we know how important it is to get preventive screenings for ourselves and our family members, but you're a nurse, you can't plan for everything, so not everything is a routine office visit or a routine doctor's visit. What do we do in those times when we can't plan and something really important and critical happens and we need to seek care?
Well, if it's an emergency situation and like someone has chest pain or maybe having a stroke, you're going to want to call 911 and get to the emergency room. But if it's a less emergent situation, something like a sore throat or a fever, there are lower cost alternatives for those non-emergent situations. So after hours, you can certainly call an urgent care facility or head over to an urgent care facility. It's the same quality as an emergency room. Another option that's really good to know about is to know what health plan resources are available to you. At Cigna, we've got a 24/7 nurse line. Many health plans have the same benefit, so jot down that number. It's like having a nurse in the family. If you wake up in the middle of the night and your child has a fever and you're not sure whether you should take them to the emergency room or an urgent care center or call their doctor, there's nurses that staff those lines that can give you some guidance on what to do next. It absolutely is like having a nurse in the family.
Susan, I love that nurse in the family. I've actually used it myself, and when I'm able to just pick up the phone and with one phone call really feel I have clinical guidance and navigation on the other end is so important, and having that resource immediately available has been terrific, I know, for me. The other thing I would say that I do that might be helpful is I actually keep the number of my pharmacy right on me. So when you're in the doctor's office and they write you a script, instead of just handing you that prescription, they're able to call it in. And so the time that saves and the ease and the wait, by the time you get to the pharmacy, it's sitting there and usually waiting for you. And it's only because you're able to have that number really handy and you just ask the physician to call it in. Sounds simple, but boy, has it saved me a lot of time.
Absolutely. So there are a number of things that you can do to prepare. One, know where the closest urgent care center is. Two, know what your health plan resources are. 24/7 nurse line, jot that number down, and then know your pharmacy phone number as well and have that handy. All those things can help you prepared for those situations that arise in an emergency.
So you really can prepare for even the most unexpected items that happen.
Absolutely.
We're going to continue this conversation because healthcare and budgeting for healthcare is such a critical issue for us as women.
So please stop by again to continue the conversation. We look forward to seeing you soon.